So this is chemotherapy. This is bleomycin. And the bleomycin is diluted down to 1 unit per mil.
Okay.
So it gets us a little bit more volume. We're doing the intralesional.
Mm-hmm.
When I'm doing the systemic, we leave it at the normal reconstitution volume, which is 3 units per ml. And the dose is going to be a little bit higher, obviously, because we're treating the whole body and kind of counting on it getting to the site. So with that, we're typically going to wait kind of at least 10 minutes. I usually end up giving it closer to about 20 minutes. Just giving it time to get to the lesion before we do the treatment. And then again here, I was going down the scar, and so I went with a needle, did a couple pokes, but I basically try to redirect it several times as I go down. We're going to go a little bit past the scar and a little bit outside of the scar because we're trying to get those margins. And then this one you can treat fairly quickly. Thank you, Laura. I usually will still give it about 1 to 2 minutes. And then this machine actually kind of makes you give it 2 minutes because when you actually start doing things, it'll tell you. Like, it takes 2 minutes to warm up on purpose.
Gotcha.
And you can't really start firing before then. I don't know that you have to do this, but it makes me feel good to kind of massage the thing into the tissue a little bit.
I think that's great.
Right?
I do. That's the whole idea, is getting to permeate that area.
To permeate it as much as we can. So we're going to give it a little bit of time. The machine's already warm, so at this point I can start heating up the tissue. And then what it's going to do once I get it going, we'll give it probably another minute or so before we start. It'll heat up that tissue for a while. Once it reaches a temperature, and it actually detects the temperature that it wants the tissue to heat up to, and it's typically between like 38 and 40 degrees Celsius.
Gotcha.
Once it gets there, there's like a 30-second little soak, and then we can actually start pulsing. Once that goes, it takes less than a minute, I would say, to do a scar this size.
Just getting started, then once you're there, boy, it's pretty fast. Did you press the blue button a second time?
You don't need to in this one.
You don't need to?
No. So in this one, you just
press
turn this into the on position.
I love it.
So yeah, the nice thing is once I'm in position, I don't then have to reach back here. I just
I'm
go like this. And I used to warm it up all the way at the edge here. I've started to warm it up here just because I feel like that's what gets the warmest kind of center of the lesion, and then I'll start pulsing in either direction from there. So I'm going to go ahead and turn this on, and now it's telling me it's heating over there. And that's a new thing with this machine. It actually tells you the degrees that it's at. Makes me feel like it's doing something. Before, sometimes you're just like, I don't know. It's taking forever. Yeah, this this version is a lot more communicative, I'd say.
Yeah.
It tells you like what the degrees is, when it's doing the tissue soak, all that kind of stuff. If there's an error, it tells you what the error is, and so you can troubleshoot a little bit more easily.
There might be one in our focus on
Sometime probably late next week, there's a software update.
Okay. And you were saying somebody has to come here to...
We'll just turn it on and have it connected to the Wi-Fi.
Okay, cool.
And open TeamViewer, and then you're good to go.
Okay.
Almost there.
Oh, very exciting.
What is it?
It's
Local. Orland. There's a form on our whiteboard. They can just go in that bag that's hanging on the whiteboard and go in the fridge to untuck.
okay.
So
Thanks, Lindsay. Almost there.
It started thundering right when it
I
got
know.
the temperature.
That's a machine probably. No, the thunder.
Oh, I thought you meant the
Oh,
quivering.
no.
I was like, what?
Oh, we're not doing anything.
Of course, the battery's dead.
Yeah,
Just pretty much all the way away.
replace the batteries on Empire the other day and no, it's okay.
Do we need to maybe send it out for repair? Is that what's looking like?
I'll try the front probe and see what it is. How many more passes do you have?
Probably 3.